Okay, for lab, we are going to start with anatomical terms and get a little bit into anatomical terminology before we get into body planes, cavities, and directions and stuff like that. Before we talk about anatomical terminology, we're going to go over a brief history of anatomical terminology, where it comes from, why we use it. So about 90% of our current medical terms come from Greek and Latin roots. So most of the terms are Greek and Latin. Remember, Latin is a dead language. We don't use it anymore, so nobody speaks Latin. But a lot of science and medical terms have Latin roots. The Renaissance period brought a lot of progress to medical terminology, but it also came with lots of confusion because nobody knew anything. It was all new terms. This also caused things to be named differently in different parts of the world. So one country would call the heart this, another country would call this. So there was not any like uniform name for certain body parts. And there are also body parts that are named after people. So when you hear the name for the spinal column, you can think, okay, probably has something to do with the spine because spinal is spine related. But when you hear the name fallopian tube, fallopian gives absolutely no indication of what the tube does. So that is called an eponym. It was named after the person who found it and not so much as its function or structure. In 1895, anatomists established a worldwide naming system, which started rejecting eponyms. So anything that was found after 1895 is not an eponym anymore. We don't accept them anymore. Things need to be named for their actual function. So anything new is going to be named after what it does. They use unique Latin names. The Terminologia Anatomica provides a standard international and anatomical terms. So this is the book that provides all of the standard terms for anatomy. They are the same in every country. We refer to them as the same thing as people in India, Russia. It's the same term. It's a very uniform system. It provides the Latin names and the English equivalents. And then in 1998, this was approved in over 50 countries. So we have like a kind of universal language for anatomy and medical terminology. So what is an anatomical term? So an anatomical term is based on word elements such as roots, prefixes, and suffixes. The terms must contain one root, and they use combining vowels to join roots with prefixes or suffixes. You don't have to have a prefix or a suffix, but you do have to have the root. So there's a middle part and then possibly a beginning and an end. The prefix is the beginning and the suffix is the end. The root is the main middle part. So for instance, we have hyperthyroidism. Okay, hyper is a prefix, it comes before. Thyroid is the root, and ism is the suffix because it comes after. The root word is always going to give you like the location of the body part or the system that this is dealing with. In this case, it is thyroid. It's having to do with the thyroid gland. So this is a whole term put together of prefix, root words, and suffix. The prefix hyper means overactive or higher than normal. Thyroid means just what it says, thyroid. And ism means condition of. So hyperthyroidism, when you put it together, means the condition of having an overactive thyroid or a higher than normal functioning thyroid. Plurals, adjectives, and possessive forms in the language of anatomy can vary greatly depending on the term. You just need to keep in mind that they do not follow the same language rules as English. Usually in English, when we're making something plural, we add an S or an ES to the end and it makes things plural. Very few situations don't. The majority of things is S or ES. In anatomy, plural forms can be many different things. You can have cortex, the plural is cortices. Corpus, the plural is corpora. You can have things that the name does not change at all. You can have things that the name drops letters and adds different letters at the end. So you just need to be aware of which terms mean what. And usually these are things that you learn as you go because it's really hard to memorize all of them because there are so many exceptions. In anatomy, adjectives often follow the noun they modify instead of going in front of them. So in English, our adjectives go before our nouns. The white dog, the blue car. In Latin, it's the other way around. Very similar to Spanish, how the noun goes first and then the adjective second. So example is biceps brachii. So brachii is the adjective describing where or which biceps, which is the arm. Brachii refers to the arm, and biceps is a muscle. So the noun is biceps and the adjective is brachii, telling you that we're referring to the biceps on the arm. The adjectival form of a term can appear different than noun form. So you could have brachium or brachii or brachii. It just depends on which term is being used. They can be used in different situations or interchangeably in some aspects, but just really knowing that brachii means arm, you'll understand where we're getting when we say brachium or brachii. But just be aware that there are different variations of words that can be used at different times, and it can be a little confusing. Understanding your root words will really help you to identify terminology when we're dealing with Latin in medical terms. So we're going to talk about the importance of spelling. So you need to be very, very precise in the use and the spelling of your terms. There are a lot of terms in anatomy that are very, very similar to other terms. Similar spelling, similar sound, similar look. However, they have completely different meanings. So you need to be very intentional on the term that you're using to make sure you're talking about the right thing. So in working in healthcare, it is very important that you are precise in your documentation or the terminology you use, because it could change the outcome and it can risk patient safety entirely. So for example, these are words that are really, really closely related in look or sound, but totally different meanings. So we have perineal. This means pertaining to the lateral aspect of the leg. So the further outside of the leg, right? Perineal, pertaining to the pelvic floor of a male or female. They sound the same, they spell almost the same, but the leg and the pelvic floor are totally different areas of the body, and you could easily get those terms mixed up. So it's very important to remember your spelling and which one you're using. Ileum and ileum. One of them is the last part of the small intestine, and one of them is a pelvic bone. So making sure that you know which ileum you are using is really, really important. All right, moving on to directional terms. So now we are going to talk about terms that refer to different directions of the body. There are quite a few terms. This is to help us get relative location and identify where things are in comparison to other parts of the body. First things first, one of the most important things in anatomy is understanding anatomical position. So when we talk about the human body, we talk about it in anatomical position all the time, always. So anatomical position is forward facing, chest up, feet together, palms facing forward and at your side. That is anatomical position. When we refer to any part on the body, we should be referring to it as if it were in this position. And remember, when we are talking about the body, it is always in reference to the patient. So if I am looking at my patient, my right is going to be their left. I will always refer to everything on their left as the left side. It's never going to be my right and left. It's always going to be the patient's right and left. So if you're doing surgery on a patient and I said we're going to take out their right kidney, would we take out the kidney that's on my right or on their right? Because the one that's on their right is the correct kidney. So we always refer to everything as if it were on the patient's body. Never relative to us, always to your patient. Okay, but remember, anatomical position is standing upright, facing forward, feet together, palms at your side, and facing forward. Your thumb should be out away from your body, palms forward, always. Okay, so we have inferior and superior. So inferior, just like it means in everyday life, if something is inferior, it's less than or not as important or below. That's what it means in the body. Inferior means closer to the bottom or away from the head. Superior means the exact opposite. Closer to the top, closer to the head, higher than. Okay, so if I'm talking about parts of the body, I would say that the head is superior to the shoulders, or the feet are inferior to the ankles. Next, we have posterior and anterior. So posterior means behind or the back of. Just like in like everyday life, we use the term post to mean after, like a post test comes after a class. Post means behind or after, so it's going to be the back of the body. Anterior means the front side of the body. So I would say that the face is on the anterior surface of the body, and the calves are on the posterior surface of the body. Next, we have lateral and medial. Medial is really easy to remember because medial sounds like middle or median, meaning close to the midline. So anything that's closer to the middle of your body, you would refer to as medial. Lateral is the opposite. It's away from the midline. So if I was comparing the sternum, which is the breastbone right down the middle of your chest, to your shoulder, I would say your sternum is medial to your shoulder, and your shoulder is lateral to your sternum. So we can describe positions or directions of the body. A person has an injury to their lateral shoulder. So when I hear that, I'm thinking it's going to be further on the outside, or their lateral back. It's going to be on the sides, not towards the middle. Here we have proximal and distal. Proximal means closest to the point of attachment, and it's used in reference to limbs. So proximal means closer to where it attaches to the body. Distal means further away from where it attaches to the body. So if we're comparing parts of the body, the shoulder would be proximal to the fingers, and the toes would be distal to the knee. So proximal, closer to attachment, distal, further away. Distal sounds like distance, makes you think further. Then we have superficial and deep. So this is talking about skin and the depths, basically. So something that is superficial is going to be very close to the body surface. So a superficial wound would mean that it's not really deep at all. Probably wouldn't need stitches or staples or anything like that. Probably just a Band-Aid, clean it up, cover it. It's superficial. It's not significantly deep. Deep means just what it is, deep. So that means it's further away from the body surface. It's more internal, closer to the core or the middle of your body, as in like the middle towards your bones. Not midline, but like the middle of like the meaty area of your body. So if we're talking about your arm, the closer to the bone is deeper. The closer to the surface where you can see it is superficial. So we use these terms a lot when we're talking about injuries to the skin or the tissue. So cuts, pressure sores, anything like that, we refer to them as superficial or deep. Now we're going to go over the cavities of the body. So the cavities of the body are basically holes in your body where organs sit. Okay? There are different ones and they hold different organs and there are different areas, and it's very important to know which cavities are where and what they contain, because there are a lot of different situations where you might need to be able to identify a cavity or what is within a cavity. So first we're going to start with the front and back of the body. The back of the body contains the dorsal cavity. If anybody knows anything about fish, they have dorsal fins on their back. That's how I remember that dorsal means back, because the dorsal fin is on the back of a fish. So in the dorsal cavity, you have the cranial cavity and the vertebral cavity. There are only two cavities on the back side of the body. The cranial cavity holds the cranium, which is the brain. It's inside the skull. The brain is within that. The vertebral cavity holds the vertebrae or the spine. The ventral cavity, it's on the front of the body, houses the internal organs. This is divided into the thoracic and the abdominal or the abdominal pelvic cavities. The thoracic cavity can be subdivided into 3 smaller cavities: the pleural cavity, the mediastinum, and the pericardial cavity. The pleural cavity holds the lung. The word pleural refers to lung. Since we have 2 lungs, we have 2 pleural cavities, one on the right and one on the left, 1 lung in each. In the middle, top part of the lungs, right below your trachea, you have your mediastinum. This area surrounds the thoracic organs, and it has part of the pericardial cavity in it. The pericardial cavity is the cavity that holds the heart. The root word cardio refers to heart, and peri means around. So this area goes around the heart. It protects the heart. It's right in the middle, behind the ribs, around the other cavities, because the heart is really centered in there to be protected very well. So next we have the abdominal or the abdominopelvic cavity. Often they are referred to as one, but just know that it can be separated into 2. And within the abdominal cavity, in your abdomen, that is all your abdominal organs. Your stomach, your liver, your gallbladder, your intestines, all of those are in that abdominal cavity. Your pelvic cavity includes the organs in your pelvis. So lower down, these are going to be your reproductive organs, your bladder, and your rectum, the very, very bottom part of your large intestine, are all going to be in the pelvic cavity. So the pelvic cavity is lower than your abdominal cavity. Those are the main body cavities, but there are a few smaller body cavities that are also important to know about. So you have the oral and digestive cavity. These contain the mouth and the teeth and basically your esophagus. The nasal cavity, that's your nose. The orbital cavity, that's your eye. Your middle ear cavity, that's your middle ear canal. Those contains all the bones in your ear. And then your synovial, these are joint cavities. So synovial is a type of joint. They have fluid in them. They make things move really nicely. And these are also cavities. So when we get to bones, we'll talk about those more. But these are also other types of body cavities that we have within our body. So in addition to the body cavities, there are also membranes that line these cavities. So we have a parietal serosa, which lines the internal body walls. So if you think of the inside of like your muscles and stuff, that would be lined with parietal serosa, like the inside of your abdominal muscles. Then there's visceral serosa. This goes over top of your organs. So all of your organs are lined in like this lining. So think of, you have your heart, think of putting saran wrap around your heart. That would be the visceral serosa if it was right around your heart. And then there's serous fluid, which goes in between the 2. So they don't stick together. They have like a barrier between them, and that would be the fluid. Because the abdominal and the pelvic cavities contain so many organs and they cover such a large area of our torso, we break the abdominal pelvic cavities up into regions. So starting with the patient's right, always the patient's right, not your right. You have the right hypochondriac, which is the top right. Then we have the epigastric, which is the top middle. Left hypochondriac, which is the top left. Now, if you notice here, the right and left have the same names. They're just right and left. So you just need to remember a hypochondriac means the top one. Okay. Going down to the middle, we have the right lumbar and the left lumbar. And then the middle is umbilical. If you know what the umbilical cord is, you know that that's what attaches you to your mother's placenta when you're growing. And that refers to the scar left by it, which is your belly button. So the umbilical cord attached at your belly button. The umbilical region is around your belly button. Going down to the bottom, we have the right inguinal and the left inguinal. Inguinal means a groin area, and it kind of sounds like groin. So it's easy to remember. And then there's the hypogastric or pubic region, which is the bottom middle. More commonly, we break the abdominal cavity or the abdominal region into 4 quadrants, like a grid. We have the right upper, the left upper, the right lower, and the left lower. Now remember, you are always going to identify them as right and left based on your patient's right and left, not yours. So the right upper is the patient's right upper abdominal area. It's easier to identify locations if we can break the abdominal area into 4 quadrants instead of just one big broad area. There are so many organs and so much space in the abdominal cavity that we have to narrow it down. So using 4 quadrants is very, very helpful, and you will often see them referred to as RUQ, LUQ, RLQ, and LLQ. That's for right upper, right lower, left lower. And this is used more frequently than breaking it up into 9 regions because this is a little easier. Okay, so in addition to cavities and directions, we have body planes. Planes refer to if we were going to cut the body, where would we be cutting it? So when we're looking at views of the inside of the body, where are we looking at them? Are we looking at it from the top down, from the side in? Where are we looking at it? So we have different views for different parts of the body as well. So a body plane is an imaginary line that we draw through the body to separate the body into sections, either top, bottom, front, back, or side to side. So these can also be referred to as cuts or dissections for surgical purposes. These are usually used for imaging and surgery. We don't go see a patient in the hospital and say, oh, we're going to do a transverse cut on them and see what's going on. Usually it's for like imaging and stuff like that. So the first type of plane we're going to talk about is the transverse plane. So the transverse plane cuts the body into superior and inferior halves. So right in the waist, cut it in half, top to bottom. So if I am looking down into something with a transverse cross section, I need to know that I'm looking at something as if it was cut in half from top to bottom. So if we take a liver and we cut it, the transverse cross section, I know I'm looking at the top of a liver and the bottom of a liver, not side to side. So it separates it into top and bottoms. It's a horizontal division. The second plane is a median or a sagittal plane. They're often used interchangeably. This does what it sounds like it does. It cuts it down the middle. So when you divide the body with a median or a sagittal plane, you are making a left and a right side, or a medial and a lateral side of the body. So if something has a median, or a sagittal cross section, you are cutting it into right and left. The last body plane that we use is a frontal or a coronal plane. This divides the body into front and back sections, or anterior and posterior sections. So if you're seeing something that has a frontal or a coronal cross cut, you're looking at the front and back of something. The last thing we're going to cover are positions. So there are multiple positions that the body can be in, and these are some of the most commonly used or the most important used for medical reasons. So first we have supine and prone. Prone is usually easy to remember because if you've ever played any kind of video games, especially Call of Duty or anything, when you lay down in your stomach, you're in the prone position. So prone is face down on your stomach. Supine is the opposite. It's on your back. And if you think of supine, it kind of sounds like spine. You're laying on your spine. So these are positions where the person's literally laying flat. We're not elevating the bed. We're not elevating the feet. They're laying flat. And they could be laying in this position for many reasons. They could be in this position for a procedure, for the recovery of a procedure, because they have a wound, because they have a fracture. Anything like that could require them to lay in either of these positions. So it's important to know the difference because you might get doctor's orders that say patient to be supine for 8 hours post-surgery. So you just need to know the difference between on the back, supine, and on the front, laying on your stomach, prone. Next we have the recumbent position. There is a left lateral and a right lateral recumbent. They're the same position, just one is on the right side and one is on the left. When you're in the right lateral recumbent, you are laying on your right side. Remember, patient's right always, so they are laying on the right side. You're not looking at them on the right. It's not what you see, it's how they lay in relation to their body. So they should be on their right side down on their side. Left side, same thing, but left side down. So this is used for a variety of procedures and recovery positions as well. You can also put somebody in this position if they're having nausea or vomiting, or postictal, meaning after a seizure. It's best to lay somebody on their side like this. The last two positions that we're going to talk about are Fowler's and Trendelenburg. So these are less common than prone supine, but they're still important. So Fowler's position is a position that just means sitting upright usually. You don't usually see many orders for it, but you want to put somebody in the upright position if you're feeding them, if they're brushing their teeth and they're bed bound, if you're giving them medications. This can also help them to breathe better. It can open up the diaphragm a little bit, and it can be more comfortable. They want to be sitting upright. They don't want to be laying flat. The technical term for the upright sitting position is Fowler's. And then Trendelenburg position is used to increase blood supply to the upper body. So we invert somebody, head down, feet up, to get the blood to rush back up towards the head.